Hi, I'm Heather So. I've been an occupational therapist for almost 20 years. I'm a bereaved mother and I've just completed my PhD looking at how to integrate spirituality into healthcare. And in this series, I'm going to be talking about some of the key things that I've learned about how to approach healthcare more holistically. In this third part, I wanted to talk about why it's so hard to even talk about spirituality. And to do that, I'm going to be using the analogy of water as spiritual questions and our lack of container to even have a framework for talking about spirituality. So if you grew up in a Western culture like me, Australia, you probably didn't grow up talking readily about topics like death, or the meaning of suffering, or morbidity, mortality, or the bigger questions around the purpose of life. It's more likely that your day-to-day conversations were around what are you going to do for your career or when you grow up, or what kind of sport are you going to play, or what kind of food do you like? Those kind of everyday conversations. Because when life is going well, we tend to live our lives more on a surface level, but it's more rare in Western culture to have open discussions around death and what might happen after death, or around whether there's a greater meaning to life or a meaning to suffering. And so we don't have a ready framework for how to approach these questions when they do come up. And so then when people are faced with a sudden healthcare crisis, and the spiritual questions come pouring out, they don't have a ready container to catch it. Many people do not have a way of catching those questions and knowing how to talk about them. The problem is then compounded when you're stepping into a biomedical model or Western healthcare system, where many health professionals also aren't trained well or don't know how to talk about spirituality either. They're not really sure about how to recognise spiritual needs, and a lot of our training is around how to recognise when things are going wrong with the body or the mind, but they're not as good at recognising when someone might need spiritual help or a referral. And in general, you might even be working on a team where there's not a spiritual expert like a chaplain, and they're generally not as well funded as other areas of healthcare. And so again, someone might come into the healthcare system needing help, but there's just not a ready framework there to be able to catch that. Many people come through and they're not even asked what their spiritual beliefs or values are, whether they have any spiritual needs during their healthcare journey. And so that's one of the reasons why there's such a barrier around spirituality, particularly in the West, is because it can be seen as a private matter, a taboo matter. It's just something that's not really talked about. And that's why language is so important, because it creates a container for these discussions, so that when people have spiritual questions, there's something to catch it. There's a way for them to talk about it, understand it, and be able to comprehend what is happening to them.